Hello, my name is Jeff Jenkins, and I am the founder and manager of Blue Water Security Services. Today, we're going to take a look at workplace violence prevention in healthcare and the need for a paradigm change. Let me ask, when you hear the words workplace violence prevention, what's the first thing that pops in your head? What's the first thing that comes to mind? I would be willing to bet that the first thing that came into your mind was security. And rightfully so, that's a pretty standard answer when it comes to workplace violence prevention. That ultimately, the security element, the security supervisor, the security officer, is responsible for all things workplace violence prevention. But that's the point of this presentation. We are in a need for a paradigm change. So let's have a discussion. Let's look at the current paradigm versus a new paradigm. The current way of thinking about workplace violence prevention and how just a few changes in our thought processes may give us a new paradigm, a new way of seeing the prevention program as a whole. So first we're going to look at security, security, security. Why is it that security has always been known for or is known for workplace violence prevention? Why has it always been only their role to do? Then we're going to start looking at how this paradigm needs to change by looking at an element called the reality of incident onset. When we look at the incidents, how does that, the whole piece of that, how does that start changing the way we're looking at workplace violence prevention? And then lastly there, we're going to look at how a simple paradigm change, how can we just change our thought process, can actually change the outcomes of an entire program by just changing one thought process. And then there, we're going to ask for questions. Now, obviously, we can't have questions on a recorded video. You can't ask us questions on a recorded video. However, we will ask that when you're done viewing this presentation, if you have any questions whatsoever, please feel free to reach out to us. You can reach out to us via our website through our Contact Us page, or you can send us an email, or you can contact me directly through my phone number, which all of that information will be listed at the end of this presentation. So when we start looking at security, 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 the very first statement there is a question, actually. So let me ask, in most of all healthcare and social services, there is a belief that all elements of workplace violence prevention is solely the responsibility of the security department or the individual that's responsible for the security function. Is that true or is that false? Now, I'm going to ask you to answer that right off the top of your head. Don't think into it. Don't start analyzing it. Think of just the statement and is it false or is it true for you today, for your organization today? I'm going to be willing to bet that the answer is true, that the organization believes and sees workplace violence prevention solely as the responsibility of the security element or the security department. A little food for thought here, though. I'm going to challenge you to look at your workplace violence incidents. Now, I don't want you to do a deep dive. I don't need to look at data and information and how it happened and why it happened. We don't need to look at that. We just want to look at the surface. The initial onset of the incident, was the officer, was the security representative there at the initial onset of the incident? I would like you to look at your cases and see if they were. And I think you'll find a interesting bit of information when you look at that. So that's your food for thought. That's kind of your homework per se. Now, the contributing factors, though, that have led and are continuing to lead to the workplace violence prevention role being solely a security function or a security role is these three factors. Factor one is, for decades, policy has dictated that workplace violence prevention is in the security department. And that's not inherently wrong that it's part of security and that security should take a lead role, but it is not solely their responsibility as a whole for the prevention program. Then if we look at the factor, contributing factor number two, workplace violence is tied to active shooter response when they are two totally different topics. Workplace violence occurs daily within your facility, yet you have a very high percentage chance of not ever seeing an active shooter. And we hope that you would never see an active shooter within your organization, within your facility. So, but they get often tied together, and ultimately the active shooter response a lot of time falls underneath the security function. So they get tied together. So therefore, workplace violence prevention goes right along with that and gets tied to that same role. And then the third contributing factor there is many times your security management and leadership are retired or former law enforcement, where in their past careers, they were inherently the sole responsibility for workplace violence response and active shooter response. So therefore, it just ties together, and it then leads the leadership within the organization to also assign them that same role. So those three factors are why current beliefs and current paradigms actually take the workplace violence prevention program and give it sole responsibility to the security function. Now, the issue with that is we have decades worth of information that show that paradigm, that thought process, that policy is not working. It's actually not producing any reduction in workplace violence incidents and negative outcomes. So this is where the need of the change is coming in. So let's move to the next piece. A key element to look at to start really thinking about this differently is the reality of incident onset. Again, so we'll look at this next statement. When you're dealing with the public, especially all the stressors that are found in the healthcare environment, workplace violence incidents can occur at any given time. Is that true or is that false? A little food for thought here. If you look at all industry, I would ask, is there any other industry that comes to your mind that has the stressors of illness, financial costs, financial loss, denial of service, denial of coverage, long wait times, and other things such as injury to a loved one. The loved one may be the person that's providing the finances for the home, and they're out of work, so now their home is being affected financially. All of these stressors that result ultimately in a person committing workplace violence. Is there any other industry that you can think of that have all of these stressors? There's not. So this is where the paradigm where we need to start changing, because as we discussed earlier, security isn't rarely ever, I would say it's less than 1% of 1% is the security person initially on the scene when the onset of the incident occurs. So a contributing factor, the very first one there is non-security staff have a much greater amount of direct contact with everyone in the facility. The security person may only see them as they come in the door or when they're rounding through the hospital or through the facility momentarily as they pass by, where the security, the non-security staff, the clinical staff, the non-clinical staff see them constantly throughout the day, every day. The second factor there is clinical staff and providers service, they're always in very close proximity of the patient and the visitors during their worst times. There's very few times in our life that are worse than when we were in a clinical environment because we're there for an illness or a sickness. So because of that, the staff, the clinical staff and non-clinical staff are in close proximity to the visitors and the patients when they're at their most vulnerable. And then the third contributing factor is there's a severe lack of training amongst the employees of healthcare-based de-escalation and disengagement training. And this in turn leads to higher workplace violence incidents and also greater severity to the injuries. Now, if you look what I just said there, healthcare-based is the key element. There is training available. There are numerous types of trainings available, and most organizations have adopted some type of training. If you have adopted whatever the training course is, I would ask you to explore that course. Take a little deeper look into that course and see, is it based on health care practices? Reason why I'm specifically saying the healthcare based practices is because healthcare has such a unique element involved when it comes to the stressor factors that need to be identified in the training process prior to the incident occurring. If the individuals being trained are trained specifically on those stressor factors and what to be looking for, they can help start that de-escalation process and that disengagement process much sooner, and either de-escalating the event altogether or disengaging and reducing the negative outcomes of or the severity of the injuries that are occurred during an incident. So that third contributing factor is a very key one to look at moving forward. But again, this is where that paradigm change needs to go from a security function and their training and them being trained to a certain level to all staff, specifically the clinical staff being trained to a certain level. Then we're going to look here now at how a paradigm change can change outcomes. If you've listened to what we've talked about so far, this isn't a big change in thinking and processes. It's actually a fairly minor just switch over. It's not a full taking away responsibility from security. It's actually taking what security is actually already doing and adding an element to it, or a few elements to it, which is enhancing what they are doing. So that statement there, currently within your facility, do you understand the true impacts of workplace violence incidents? If yes, how so? Now, obviously, you're not going to be able to answer that to me right now, but I would like you to take that question, write it down, and if you do understand it, identify how you understand it. Now, when we look at these contributing factors, it's going to kind of explain out what I mean here. A little food for thought, though. If you're unable to account for the workplace violence impacts to your facility or to your staff, your operation, and the finances of your organization, then how do you know your prevention program is being successful? And also, if your prevention program is, again, solely underneath the security responsibility and you're not able to say, yes, this is how it's impacting our facility, then ultimately your whole entire program may be a program on paper, but it has no measurable results. So you will not be able to actually understand how you're actually reducing the number of incidents or the impact to your organization. And so some of the contributing factors here is The direct involvement of the clinical staff leadership and then the non-clinical and their leadership as well in identifying workplace violence incidents. So that's just a long way of saying reporting. Well, reporting incidents, if you are currently using a critical incident reporting format, that's you're still reporting. Unfortunately, that's also the same format used for multiple types of incidents reporting. So when you're trying to look at data and certain data points, one, it may not be collected on that type of format. And secondly, there's all those other data that's within there. There's all those different types of incidents that you have to actually do a data mine and drill down through to find the information you're looking for. So then the second factor is providing healthcare-based de-escalation and disengagement training to all staff and facility. So not only did I put it in the slide before, I put it on this slide as well, because it is an absolute key factor that not just the security staff are trained in de-escalation and disengagement because of what was on the initial slide, that they are not there at the onset of the incident, or they are rarely there, less than 1% of 1%, as I've said before. So because of that, the training of all staff needs to be at a certain level, specifically the clinical staff, because they are in contact with all the patients and the visitors pretty much throughout the entire time they are in a facility. And then that third contributing factor, installing a standalone incident reporting system will allow you to track the key data points. Now, I've said key data points a couple times. This is where the questions will come in, because there's a whole nother section on data collection and what are the key points and why that they contribute to the success of a workplace violence prevention program. I will also say that in our other video on our YouTube channel here, you can actually watch that presentation. It's on the key elements to a successful workplace violence prevention program. That'll also outline some of that key data points. And then if you have other questions about how to collect them and what's the importance of collecting them and how you can tie the mitigations to there, then contact us, ask us questions, because ultimately if you collect your data and look at the key points and identify the mitigations that go along with that, you can then start to track the hopefully downward trend in the number of incidents and the negative outcomes and the severity of those outcomes. And that's why I recommended installing your own standalone workplace violence incident reporting system, because then it can be separated out from the rest of the incidents that occur within your facility. And so like that last sentence says, this factor will involve HR, workers' comp, security, and risk management. There's a very specific reason why I identified those departments within your organization, or those functions within your organization, because the information that comes from those groups are keys to identifying how your program is doing when it comes to the reduction factors. And in the end, even though the incident is reported and the type and the style and the severity may be reported, and it may be reported out and tracked, if you aren't really looking at certain financials, certain workers' comp issues, maybe litigation and a few other risk factors, if you're not identifying those numbers as well, it will be almost impossible to track if your program is moving in the right direction or not. So again, these are the contributing factors of once you've changed that paradigm and once you start getting these others involved and having the training and taking it, not just taking it from security, but adding to security and adding these elements on top of it, you can have a truly successful workplace violence prevention program. And ultimately, when we're looking at organizations that may be very large. If you are a healthcare system, a multi-billion-dollar healthcare system, you may not know that at this time you may be seeing the range of 50 to $100 million each year loss to workplace violence incidents, but you will not understand that or will not know that because the way they are earmarked in the workers' comp format. So again, this is where this paradigm shift and this information needs to be changed and have a more whole approach that everyone is involved in. So to conclude, some things to think about. In the current state of healthcare and workplace violence prevention, there is a need for a change in the paradigm. You know, it is true that security takes the leadership role. And if you have a workplace violence prevention committee, which is very advisable, yes, the security director should be the chairperson, but not always will be. But they do take a key role in the prevention program. But it is vital that everyone plays their role. And then clearly defining the information needed from each one of those roles is paramount to a successful program. And then ultimately the goal for the entire committee should be not only the reduction of the amount of incidents, but also the negative outcomes. And again, there's no way to track that without looking at the data and making the data you're collecting not only for purposes of meeting the regulatory requirement, but also making that data work for you so that you can actually make a positive impact and show the reduction of the negative outcomes. So it's been done the way it's been done for decades. And changing that way it's been done is going to be paramount. And changing that paradigm and the way we're looking at things and the way we're seeing workplace violence prevention in healthcare needs to be changed, not within security itself, but throughout the entire culture of healthcare and on the entire culture of social services. So Mr. Wayne Dyer said it best: if you change the way you look at things, the things you look at change. So if you think about that statement, if you change the way you look at workplace violence prevention, you can actually change the workplace violence that happens in your healthcare organization. All right, so we've come to the time for questions. Again, I would definitely encourage you to reach out to us. We would love to hear from you and answer your questions. And if we can be of any service whatsoever, we would gladly help you reach your workplace violence prevention goals. And this is our contact information. That's my email. You can call my office number or my cell phone. And then please stop by our website, www.bwgsecurity.com. We have several different types of products there for workplace violence prevention plans and for workplace violence prevention reporting. So also we have a couple of workshops coming up, and we would love to see you at those workshops where we will take a much deeper dive into what we just discussed today, and with the ultimate goal, which is our goal from the beginning of this company, when we started this company. Our mission statement is to help healthcare organizations reduce workplace violence incidents and safeguard their staff. Thank you for watching this presentation, and we look forward to hearing from you.